Now, to analyze this developing incident in ADAMAWA State, I'm now joined by Professor Alero Ann Roberts, public health expert, honorary consultant at the Lagos University Teaching Hospital, LUTH. Thank you so much for joining us on Newsnight. Now, an outbreak like this, I mean, it's surprising to hear that this has lingered for as much as, 2 years. And these people have been seeking help in the traditional way. Number one, this does raise questions about Nigeria's preparedness for emerging diseases and, similar outbreaks, doesn't it?
Absolutely. Thank you so much for having me. And the truth of the matter is Burley ulcer, which is caused by the same family of bacteria that cause tuberculosis and leprosy. This one is caused by Mycobacterium ulcerans. These are very slow developing infections, and that is probably the issue that has affected the residents. It starts as this small, painless nodule, almost like a mosquito bite, easily ignored, not a lot of pain, itching perhaps, and there's not enough for them to go to the health center. Besides, to be honest, it is a disease of what we call the poor and marginalized populations, where access to formal health facilities is poor. The facilities are probably far away, the hours they are open doesn't suit their lifestyle, they are open, at the time when they've gone to work or gone to school or gone to the farm. And in any case, the nodule is painless, it's just itching, and it can progress like that without a lot of pain for a very long time until it becomes this open ulcer that is undermining the skin, the flesh underneath, and the bones. So you can understand why, if you were not on top of it, if you don't have this as a high index of suspicion, you would not immediately go to the hospital.
Right.
And this is clearly what has been the issue in this area.
Well, it's good that you named it Burley ulcer. So I mean, we can't call it a mysterious or strange disease. I'm glad we're able to clear that out of the way, that it's not unknown to medical science or even to, medical doctors like yourself. Now, is this a contagious disease that we're dealing with here, or is it non-communicable?
The transmission of this disease is not very well understood. This is why it's called one of the neglected tropical diseases.
Right.
It's very slow. We believe it's this stagnant water. We believe it's an infection through this wound in the skin. It will be contagious only because if you tend to live with people that have it, there's a very high chance that if hygiene is poor, you could catch it. But it's not as contagious as, say, the common cold or as, say, malaria or Ebola. It's not, but it is still a problem because it's of its slow destruction of the skin, the flesh, and the bones. And eventually, when it becomes as bad as it has become in Malabo, people then need admission and need very expensive treatment for a very long period of time.
Now, so far, we're hearing about 28 people have been infected and 6 fatalities. Is that cause for worry in terms of the fatality rate?
Absolutely. 6 people dying from Burley ulcer is 6 people too many, because sadly, when you really understand the pathophysiology of this disease, you realize that it is a failure of the health system. Because the disease is so slow and so difficult to catch, so to speak, and it's a failure when we know the name of the disease, we know the cause, we know the treatment, we know the prevention, and then people are still dying of it. So 6 deaths is still 6 deaths too many.
Right. Now, let's talk about prevention and then, of course, treatment. I mean, you say it's in the family of tuberculosis, and so far tuberculosis is actually treatable, unfortunately, still fatal in so many cases, especially in this part. Let's talk about prevention. I mean, while we're waiting to understand all the ramifications of this disease, how can Nigerians protect themselves from contracting it?
Very easy. much greater personal hygiene, understanding the importance of sanitation, running water, and reporting even the smallest nodule. Now that we know that this is in the environment, anybody who has a painless lump should please report to a primary healthcare center. The issue is that by the time they get to the primary healthcare center, the wound has become far beyond the capacity of a primary healthcare center to treat it. They now need to go to a teaching hospital, to a reference hospital, and a lot of people are reluctant to do that. So we need to be able to tell people to go very early in the disease, when it's still a painless lump or a painless swelling.
Yes, indeed.
And to report anybody in the family or the community that has it.
Right. I mean, in that report, we heard, you know, the respondents saying, well, I mean, they didn't go to hospital, they didn't seek hospital help, they had to rely on traditional medicine. Is there any role that traditional medicine can actually play in, you know, tackling this disease, especially in the early stages?
Unfortunately, not really, in the sense that a lot of times they go to this, they use unverified tradomedical products. What we would prefer, honestly, is that the tradomedical practitioners are brought into the formal system and taught what to look for and what to do in the early stages. Because we cannot get away from the fact that the community residents trust these tradomedical practitioners more than they trust the formal health sector. And we have to leverage on that.
Yeah, of course, there's the issue of access to, you know, healthcare, even at the primary level, though you say that this is actually beyond primary healthcare. And unfortunately, this is also happening, this outbreak, though it's not fresh, it's not new. We're hearing about it now at a time when resident doctors have down tools, at least, you know, warning the government that something needs to be done. How more complicated is this?
Very, very complicated. The first question I would want to ask, which I was trying to find out, is how many doctors does ADAMAWA State have?
Right.
How many of them are practicing at the primary healthcare level? Because the issue is access to formal healthcare, for access to trained health practitioners who know what to do in these situations, who can administer the appropriate treatment. The other issue we must consider is that the treatment for this is 6 to 8 weeks long. Right. Now, a lot of us as West Africans are not really used to treating anything for that long. You know, we believe in this microwave treatment where take 1 or 2 tablets, 1 or 2 days, and you're done. But to have to keep on taking the drugs every day for 6 to 8 weeks is something that we're not used to as a people. So we need proper education, and we need that conviction, we need that commitment by healthcare practitioners to make sure that the people are sticking to the treatment regimen.
Now, very quickly before I let you go, since this is happening within the ADAMAWA State, you know, within ADAMAWA State, what advice would you give the state government, maybe at the local level also, and of course the health facilities there to help to ensure that this doesn't even spread across the country?
I only have one piece of advice, and that's for the state government. Do everything you can to incentivize and remunerate all your healthcare personnel. You are going to need them if you're going to turn the tide on this. What you do not want is your healthcare personnel walking away from the state because they're looking for a means to live. So please, whatever you can do to incentivize and remunerate all your healthcare personnel, not just the doctors, the nurses, the medical lab tech, the physiotherapists, the pharmacists, everybody, so that you have a strong team to be able to turn the tide on this.
Yes, indeed. I have to say thank you very much, Professor Alero Ann Roberts, public health expert, and joining us on Newsnight tonight. He's also honorary consultant at the Lagos University Teaching Hospital, Luth.